Hey there, it's Dr. Kanab, and it's a beautiful day down here in North Carolina, so I'm coming to you from my patio. If you're dealing with knee osteoarthritis, you might be looking for relief from pain and stiffness. Today, we're going to talk about two treatments that are commonly used for managing arthritis, PRP, or platelet-rich plasma, and steroids. But what exactly are they, and which one is better for long-term relief? Let's dive in and find out. Osteoarthritis is a condition where the cartilage in the knee breaks down over time. This causes pain, swelling, and limited movement. To manage these symptoms, doctors often recommend injections like steroids or PRP to help reduce inflammation and provide relief. Think of steroids like this yummy candy bar, and PRP like a healthy energy bar or these healthy nuts for your knee. Let's break this down. Steroids, like that sweet candy bar, can give you a quick boost. They work fast by reducing inflammation and help you feel better quickly. This is great for temporary relief, sort of like that sugar rush when you eat candy. But here's the catch. After that initial boost, the effects wear off quickly and you crash. To make things worse, steroids can also cause negative effects on the joint over time. When you use steroids repeatedly, they cause problems like cartilage breakdown and bone weakening. Imagine eating that candy bar too often. It might give you a burst of energy, but over time, it can leave you feeling worse. Steroids also leave you worse off, causing damage to your joints, your tendons, and your bones, leading to long-term harm. Now let's talk about PRP, the healthy energy bar for your knee. PRP is made from your own blood. It's rich in platelets, which are cells that help healing and repair. When PRP is injected into the knee, it stimulates healing by increasing tissue repair and regeneration, helping to restore some of the damaged cartilage and improving joint function. Here's a key point. PRP might not give you instant relief like steroids, but over time it outperforms steroids. Studies have shown time and time again that after the initial honeymoon period where steroids provide quick relief, they wear off fast. But PRP continues working, giving longer-lasting results and helping to slow down the progression of arthritis. Comparing PRP to steroids for the knee is like comparing the tortoise to the hare in that famous race. And we all know who won that race. These aren't just my opinions. Research from Dagestar in 2021 and Elksnins in 2020 demonstrated that while steroids might provide short-term pain relief, say a month or two, PRP leads to better overall joint health and less pain in the long run. PRP not only helps reduce pain, but also promotes healing and better function of the knee joint over time. With PRP, it's like you're getting two treatments in one. Now, why is PRP better in the long run? Well, PRP isn't just masking the problem, it's helping to heal it. On the other hand, steroids might relieve pain temporarily, but they don't address the root cause of osteoarthritis. And in the long run, they can weaken the tissues that help support your knee joint. PRP works like that healthy energy bar during a marathon. It's designed to help you go the distance and keep you strong as you move forward instead of giving you a quick burst of energy that fades out, leaving you in the dust. If you're wondering about the science behind this, multiple studies support PRP's effectiveness. Research, including studies by McLarnon and Heron in 2021 and Elksnins in 2020, found that patients who received PRP injections experienced less pain and better knee function compared to those who got steroid injections. And don't forget, PRP doesn't have the same negative effects on the joints that steroids do. Of course, every person is different. It's important to talk to your doctor about what treatment might work best for you. But if you're aiming for long-term pain relief and joint health, PRP is definitely the better option for managing knee osteoarthritis, especially when compared to steroids. To sum it up, steroids can provide quick relief but come with long-term risks. PRP, on the other hand, takes a little longer to show results, but it helps to heal your knee and can provide lasting pain relief. So when you think about managing your knee osteoarthritis, remember, PRP is like an energy bar for your knee, building strength for the long run. Thanks for watching. If you found this helpful, don't forget to like and subscribe for more health tips. And remember, take care of your knees. They're the only pair you got.